Very good. So over the next 20 minutes or so, I will provide a quick introduction to Fortify Health, the organization. And then I'll hand it to Ashwin, who will go into much more depth about the work that we do, and also introduce some of the current roles that we are hiring for at Fortify Health. We will then hold at least half an hour at the end to take any questions that you may have. I encourage you, as either Ashwin or myself are talking, to share any questions in the chat. We may respond to the questions in writing. We may wait until the end of the presentation to answer those questions. But I encourage you to please use the chat to write down any questions at any time, and we will look to respond to those as they come up. So as I said, I'll start off by just providing a little bit of an introduction to our organization at Fortify Health. So at Fortify Health, we are really working on the challenge of anemia. Next slide, please, Irene. Now, as you can see on the screen, there are some terrifying statistics when we talk about anemia. Over 50% of women between the ages of 15 and 49 are anemic. Over 2/3 of children under the age of 5 are anemic. Arib, if you could please click through. And as you can see, this is over 20 crore people. The combined populations of Maharashtra and Gujarat, just really terrifying numbers of people who suffer from anemia. And to the next slide, please, Arib. One of the main challenges that we face when we talk about anemia is that it has a lifelong effect on the health and the brain development of people. If a child is anemic, it means that they're not getting enough red blood cells, oxygenated blood, to their brain and to their vital organs. And so it means that children grow up, they may be stunted, they may be wasted. It may mean that their brains are not fully developed. And sadly, this is not something that you can catch up later in your life. If you miss that in the early years, you lose it for the rest of your life. And that is why we really must deal with this challenge of anemia. If you could please click through, Arib. Now, I don't want to be too negative, too much sadness, too much doom and gloom here. Thankfully, we know the solution to anemia. And Arib, if you click through, the solution is simple. It's eating a diet that looks like this. Lots of fruits, lots of vegetables, lots and lots of different colors that you can see there. Milk, cheese, oil. This is a diverse, healthy diet. That is the best solution. If someone is able to eat this type of diet, it is much less likely that they will suffer from anemia. Now, if you're living in India, as I am, you will well know that many people can't afford or can't access this type of diet for all types of reasons. And so that's where the second best solution comes into play. The second best solution is something called fortification. Fortification means adding these essential nutrients into food that people are already eating. These essential micronutrients are things like iron, folic acid, vitamin B12. And if you can add these essential micronutrients in the right amount to the food that you're already consuming, then you can reduce the likelihood of having anemia. And it's a really great solution. It's extremely cheap. It doesn't require someone to change the food that they're already eating. As you will likely be aware, over half the population in India already consume wheat-based foods as part of their ordinary diet, be it rotis, chapatis, naans. And there's a lot of scientific evidence behind fortification. Over 105 countries around the world have mandated fortification in some manner. And so this is a second best solution. We always like to be upfront. The best solution, to be clear, is that diverse diet. The second best solution is something called fortification. And so that's what we focus on at Fortify Health. Please, Reem. One thing that is remarkable is how cheap it really is to fortify wheat. And so as you can see on the screen, for less than 100 rupees, we are able to fortify a ton of wheat flour. A ton of wheat flour can serve many hundreds of people for a year. For 100 rupees, it is remarkably cost effective. We can really improve a lot of people's lives for not much money. So now I'll hand it over to Ashwin, who will share much more detail about our organization and what it is that we do at Fortify Health. Thanks, Ashwin.
Yeah, thank you so much, Tony. Yeah, as Tony had just set up about the problem of anemia and the challenges and why fortification is one of the things that about fortification is how cost effective the solution is. As Tony had mentioned, about like 100 rupees is probably worth like fortified atta for, I think, for 8 months for all the people who are there currently attending, which is like 40 plus people here. So that's how cost effective this program is. About Fortify Health, we are a 70 plus organization, 70 plus employees. And we started circa 2017-18. That's when we had the seed grant to understand the background about, conduct some background scoping about wheat flour fortification. And since 2021 onwards, we've started expanding rapidly. And we are a growing organization with a very specific focus. Arif, do you want to go to the next slide? So we're a non-profit that enables access to micronutrient-rich wheat flour to reduce and prevent iron deficiency anemia. I'd like to highlight 2 words. One is enable access. Now, Fortify Health is not in the business of selling fortified atta. We are enabling others. It could either be millers, it could be our partners, it could be government or government departments. We are helping them fortify atta so that they could then provide it to their beneficiaries to tackle iron deficiency anemia. We are an FCRA, we are a project housed within FCRA registered organization called Development Consortium. Our team is largely based in Maharashtra and Madhya Pradesh, but spread across lots of places. In fact, we have a huge team also in Delhi, Punjab to Telangana and other different states. How we achieve this? Before doing that, let me just explain the theory of change. So theory of change is basically a roadmap of how our efforts will lead to a sustained change. Now, for that, what are our activities? What are the inputs? Break it down into 3 parts. First is the capital support. We provide capital support to millers to help them transition from fortified atta to fortified atta. We also provide technical and regulatory support to ensure that the atta that is being produced is within the standards set by FSSAI. And also we have allocated some funds to ensure that there is a behavioral change. Now, based on these inputs, what we get, Arif, if you go to the next slide, the output is a high quality fortified atta. Now, this atta meets the FSSAI standards set on wheat flour fortification, and that can be distributed large scale to the population in need. When people consume fortified atta, we expect the outcomes to be reduced levels of anemia. And there are various evidence across the globe, including India, which has shown that regular consumption of fortified wheat flour has led to significant reduction in anemia levels. Now, based on these outcomes, we expect a lasting change in terms of vulnerable population, especially children and women, pregnant women, to have a much better, healthier lifestyle. Arif, if we can go to the Next slide. And this is our long-term vision. Is consumption of Fortify data can lead to health gains, which could help not just the individual, but at a large scale, the population itself. And we think this is a public health intervention. If we can go to the next slide. So to achieve that, we use three-pronged approach. The first is the open markets, second is the partnerships, and third is evidence generation. Now, we'll deep dive into all three of these approaches and how that helps us achieve our goal. In our open markets, our work is we primarily work with millers who supply wheat flour to open markets and help them transition from atta to fortified atta. Now, we help them do it by providing support to cost neutrally transition. What does that mean, cost neutral transition? Means that we will provide all the necessary support and capital required for the millers to transition without any additional cost to them. And in doing so, we hope that and then we ask the millers to also not pass the additional cost to the customers. We have, if you go to the next slide, I can explain like what are the biggest challenges faced by millers. So one is obviously cost of fortification, which involves like the equipment, the recurring cost of premix and quality control. Now for that, we provide them with the microdoser, we provide them premix, we provide them lab testing equipment. The second challenge they face is ensuring that quality standards are being met. Now we have a team that actually supports in ensuring that quality standards are being met. We provide them technical support, we conduct lab tests, and we help millers also get Plus F endorsement. And thirdly is for the lack of consumer demand for fortified data, we also allocate some fund, which we call it as market awareness fund of 1 lakh rupees for each partner miller, so that they could also use that to market fortified data and build awareness. I mean, doing so, we have had extraordinary success in meeting and having like lots of millers being on board with fortified wheat flour. If you can go to the next slide. So as you say, across India, we have like 125 plus partner millers across India, fortifying 30,000 metric ton of atta each month through open markets. And it's been an extraordinary growth, like 3 times the growth in the last 18 months only. And this has enabled, if you go to the next slide, we approximate to have reached around like 7 million beneficiaries across India as of January 2025. Now, these are like, this is the job of the open markets team. I think the aim for us, and I can say that confidently, that not few organizations have an understanding of how to work in ground, especially on fortification of wheat flour, because we work with so many millers, understanding and troubleshooting the problems, and also supporting and understanding their challenges and how to resolve them. After open markets, the second approach is, is partnerships. Now, this is the team that I co-lead. Now, partnerships team is focused on partnering to help mainstream wheat flour fortification. Now, we have broadly 2 types of partners. One is the state governments. You can also include central government, state and central governments. We are trying to work with them to help them transition their welfare programs from atta to fortified atta. Also, we work with non-profits and quasi-government organizations to implement fortified atta in their meal programs. Some of the examples of our work include we are the technical support partners in Andhra Pradesh PDS program. We have letter of support currently with MP PDS program and Maharashtra TDD, which is the tribal department. We are also engaging with tribal departments in different states, and we're in early conversations with states in Maharashtra and Punjab and Rajasthan to see how we could deploy fortified wheat flour into their safety net programs. Now, this last approach is the evidence generation team. So our monitoring and evaluation team works to inform public about the value of wheat flour fortification and generally food fortification. So we do that in a couple of ways. If you can go to the next slide. We have research partnership with several research organizations, IIT Delhi. There are other partners like CFTRI, GAIN, FFI. These are all organizations working in wheat flour fortification space. So we work with them to see how we could generate evidence and also consolidate and gather literature reviews to understand what is the impact of wheat flour fortification on anemia and in general health of people. So we'll get to the point of this, which is like why join Fortify Health. Now, probably there are three main reasons why we should consider joining Fortify Health. First, we can talk at an organization level, culture and growth. So at an organization level, do you want to go to the next slide? So at the organization level, I think there are certain things that Fortify Health stands out. Firstly, we are mission aligned, which is like we are very clear that our theory of change is access to micronutrient-rich wheat flour to tackle iron deficiency anemia. We are very mission aligned on it. We are not, there are plenty of other vehicles for fortification, but we are focused on just wheat flour fortification because it's cost effective, there is a strong evidence, and it's neglected, which means that not many people are doing it. Secondly, we focus on cost effectiveness as one of our North Stars while working. As I said, it's cost effective intervention, and that is something that is quite different from lots of other nonprofits that work in this space. We strongly focus on evidence and empathy as an approach. Now, empathy for the beneficiaries and the larger problem, and evidence is the way through which we inform our activities. If we find evidence contrary to something, then we might as well pivot, because that is how strongly we believe evidence should be informing our actions. And lastly, we have like strong funding. We can share the details later, but we have a strong funding, and we have planned out how to. We have a runway for some foreseeable period, and we've focused on scaling the organization to ensure that we reach our targets. The second aspect is the culture. Now, we are, I think, egalitarian culture is a word like, we can also say like a flat hierarchy. Feedback forward organization. We focus strongly on work-life balance. Many of our employees work from home and remote, unless there are like travels. But we strongly value, built a strong culture, and we are always open for listening to feedback from our employees and also ensure taking care of our employees. Thirdly, there's a strong growth, not just at the organization level, but at opportunities to growth at a professional level for potential people who are joining Fortify Health. There's a strong culture of mentorship and skill building. There are examples of career progression within org. Some of people who have joined as officers are now in a leadership role, which goes to show that how much people have progressed within the org. And given that we are young and vibrant organization, there are more opportunities to grow. And we have like L&D opportunities as well. So to summarize, it's a very strong mission-aligned, evidence-driven decision-making within the org, strong culture, keeping people at the heart of it, and then opportunities to grow within the org and also professionally for your future career prospects. Moving on. So there are a couple of types of roles at Fortify Health. I'll just put this earlier that these are the types of roles that are there, not necessarily all the roles are open right now. So as I mentioned, we do a lot of advocacy in terms of partnerships. So there'll be advocacy-based roles in which you'll be doing a lot more client-facing roles, where you're talking to nonprofits or governments. There's Miller support, where our officers and technical team is working with Millers to implement wheat flour fortification. There's a research and evidence team and strong focus on research. So there are like research type roles within our org. Monitoring and evaluation team that looks at tracking quality data, assessing impact, and designing evaluation studies. There's a strategic team within Fortify Health that looks at strategy and coordination to see how cross-department collaboration and strategic initiatives, opportunities to implement. And finally, there are operations role, which is perhaps like the nervous system of Fortify Health, which manages the finance, HR, admin to support organizational and improve its efficiency. So these are all the gamut of roles within Fortify Health. Now come to the part where could be relevant to many of you, which is where do you come in? So currently we have, as of now, February 2025, we have 4 open roles. 4 roles are Chief Operating Officer, Partnerships Manager, Chief of Staff, and Finance Officer. We'll go into the description of each one of them, some benefits, and also what could it look like and an ideal candidate for this. So, Arif, if you can go to the next slide. Yeah, don't you want to talk about?
So the first role listed here is a senior leadership role in the organization, that of Chief Operating Officer. This is someone who would have some good level of experience working in areas such as finance, HR, hiring, administration, risk management, experience working with boards, scaling organizations. What does governance look like? This is someone who I would work closely with, along with our Chief Programmatic Officer as well. One thing you will note is that this role is closing at the end of the week on Friday. It is a role that we will not reopen. So the final date to apply is Friday, the 28th of February. And please do apply sooner rather than later. We're already reviewing applications. Arif, next role.
So the partnerships role comes under the partnerships team. The role involves like a client-facing role where you'll be expected to work closely with government bureaucrats to help negotiate and communicate and advocate for wheat flour fortification. You'll be working very closely with the partnerships team, including myself. If you're interested or have an interest in working with the government to see how it functions and how do you want to communicate, negotiate, and persuade, I think this is like a great opportunity and also has a outsized impact on since anything that the government implements would be at scale, and that could have massive impact, social impact. The role again closes this week on the 28th. The key information are posted here. Happy to answer any questions you may have. And it's an exciting role for anyone who wants to work closely with the government and nonprofits. Ari?
So the next role is that of Chief of Staff. A Chief of Staff is what we call a generalist role. Ashwin just introduced the partnership role, that is a more technical specific role. A Chief of Staff is someone who can work on many different types of things. This is a person who would work very closely with me in supporting me with various executive sort of functions. This includes fundraising, strategic development, communications, governance, management of long-term projects. A high-quality candidate is someone who can show experience with strategic thinking, someone who is adaptable, someone who has shown an ability to learn new things rapidly. I am, of course, biased. I think this is a particularly exciting role for someone who is interested in leading a nonprofit organization, as this person will get a unique insight into what goes on in the CEO and the C-suite role of a rapidly growing organization. This role is closing on the 18th of March, so there's still a couple of weeks. However, I will note that we are already reviewing applications, and so I encourage you to apply sooner rather than later. You will have a better chance of proceeding to interviews if you apply sooner for the role. Ari? And the final role is that of finance officer. This is someone who would work in the operations team, someone who has technical experience working with finance, including financial reporting, vendor management, and other compliance requirements. Of course, this is someone who should have strong numerical skills, strong quantitative skills, be able to work in Excel, Google Sheets very, very effectively. It's also someone who needs to be a high quality communicator, because the finance officer will be interacting with all 80 plus team members within the organization and many external stakeholders as well. This role is closing next week on the 3rd of March. Ashwin, back to you.
Perfect. Yeah, thank you so much, Tony. So these are all the things that we had. You can subscribe to our newsletter to get an update on whatever work that we're doing, as well as any opportunities that may arise now or in future. We can open this up for questions. Arib, I will look to you because there are lots of questions already that we may need to answer. We can probably go initially from those questions and then open it up for anyone who might want to share any other questions that they may have.
Yeah, right. Thanks, Ashwin. So we can go step by step, starting from the beginning.
Cool. So in that case, how about Tony? I can just read the question and we can identify who wants to answer that.
Sounds good.
Perfect. So one of the questions is for evidence generation, who funds the initiatives and where can we access studies, reports completed thus far?
So we have an internal research team that conducts research. We also have partnerships with a number of institutions, as Ashwin was mentioning before, including IIT Delhi, CFTRI, and NIFTM. A lot of the research work that we do is not made publicly available. It's actually work that we use directly with our partners to inform existing partnerships. There is some research work that is made public. I encourage you to follow our social media and our website, where you will see some of that work. There's also a number of published papers by various members of the team from some of our research work. In terms of who funds our research work, our funders are GiveWell and Founders Pledge, along with a number of other smaller funders, and they provide support for all of the work that we do at Fortify Health.
Perfect. Gorby asks, given the diverse dietary habits in India, do you see any limitation in reaching populations that do not consume wheat flour regularly? Are there plans to expand fortification efforts to other staple foods?
Yeah, I think, Ashwin, you're welcome to answer that question.
Yeah, I mean, it's a simple case that our mission is very clear, that we focus on micronutrient-rich wheat flour. So the easy answer, I mean, at least the easy answer is no, we're not planning to expand our fortification efforts to other staple foods. And one of the reasons why we think about this is neglectedness is one of our key tenets at Fortify Health. Neglectedness is basically a space where you can have neglectedness is if there are other people already who are working on a problem, then your marginal impact is lower. So we believe that other staples, there are excellent organizations already rice fortification, salt fortification, milk fortification, oil fortification. They're much better and very good reputed organizations that are already working on them. Wheat flour fortification is one space where we thought there aren't many organizations who are doing excellent work. So we don't plan to expand fortification efforts to other staple foods. Do we see any limitation in reaching the populations? I think that's at a fundamental level, that if somebody is not consuming wheat flour, we cannot force them to consume wheat flour. So in such a scenario, what we focus then is on states where there is significant amount of consumption of wheat flour. So I can give you, at least at a partnerships team, how we are thinking about is we have did a landscape analysis and identified states where consumption of wheat flour is significant enough to have an impact on anemia levels if there is regular consumption of fortified wheat flour. So we focus only on those states, the higher wheat consuming states. So most of our work that you would see would be across the northern belt and less in the southern belt, or where consumption of wheat flour is limited. Okay, moving on to next question. Vijay Shri Upadhyaya asks, how does Fortify Health measure the impact of its wheat flour fortification programs on public health outcomes?
I'm happy to take that question. So the way we measure our impact is that we leverage literature that already exists. The research around wheat flour fortification is extremely strong. There are many meta-analyses that exist, including one from Cochrane, published in 2021, which estimates that if someone is consuming an appropriate level of fortified wheat flour, so over 75 grams per day, then what's called the risk reduction ratio of their anemia goes down by 27 to 41%. So the likelihood of them suffering from anemia goes down by 27 to 41%. We already know how many metric tons of wheat flour we are helping to fortify on a monthly basis. It's approximately 33 to 35,000 metric tons this month in February. We can estimate how many millions of beneficiaries we are reaching, because there is data gathered by the government of India on what is the average daily consumption of wheat flour. So that is how we estimate that we are reaching between 7 and 8 million beneficiaries in the month of February. And then we know from the meta-analyses that I just mentioned, what is the reduction in anemia. We know the anemia levels in each state. This is measured by the government of India through the National Family Health Study. And it's through this that we can estimate the impact that we are making on anemia. So that is the mechanism that we and our funders, especially GiveWell, use to determine the impact that we are making. If you'd like more details on this calculation, you can search GiveWell Fortify Health, and there is a very complex, very detailed Google spreadsheet that's publicly available that goes through and provides you a very specific calculation of our impact.
Perfect. Thank you so much. A question, another on scaling. When you talk about scaling, what is your next 5 to 10 year projection and targets?
Absolutely. So I'm not going to give a 5 to 10, I'm going to give 3 years. So by the end of 2027, what we are focusing on doing. By the end of 2027, we want to be operating in all 16 wheat-consuming states of India. We are already currently working in 12 of those states. We want to be reaching more than 25 million beneficiaries per month. Currently, we are reaching between 7 and 8 million beneficiaries. And we hope to be working with at least 5 social safety net programs around the country. These are programs such as the Public Distribution System, PM Poshan, ICDS programs. These programs target the most vulnerable members of our society who are much more likely to be suffering from anemia. And so we really would like to be working with the governments in these states to support them with distributing fortified wheat flour. This is something which the partnership manager will work closely with Ashwin and the rest of our partnerships team on in the upcoming years. Sadly, in India, the levels of anemia are still terrifyingly high, which means that we have a lot of work left to do. And it's not just Fortify Health. Of course, many different organizations are working on trying to reduce anemia around the country. It will take all of us working strongly together to try and reduce and prevent iron deficiency anemia.
Great. Tony, so there are some questions on Chief of Staff. So I can read out some of the questions and you can just answer them. In that way, I think we can breeze through the questions quickly. So I'll just go through the list of questions. Does Chief of Staff role involve travel to various locations? What should I just continue? I think this is a quick answer, but oh. Okay.
Yeah, put all the questions down. I'll answer them all in one go.
Yeah, okay. So first is a question on travel. Second, what are some specific projects the Chief of Staff would be working on? Are these strategic projects that have an overarching impact on how the org approaches, or they would be more support projects to what CEO is leading? If you can provide more insight on the growth opportunities for this role, will look like that would be helpful. Since Chief of Staff is a one-year position, could you please outline the key expectations and success measures over this time frame? Chief of Staff was opened earlier as well and got reopened again. So will you be considering previous applications to this role as part of the talent pool? Is there a possibility to apply for multiple roles so you can determine a profile's greatest fit?
Very good. So to answer the questions in order, travel will be expected if you are an international individual, expected at least twice in a year. If you are based in India, then my hope is that the Chief of Staff will travel much more frequently, especially to visit team members and to observe our operations on the field. We strongly believe in being a work from the field organization. And we fully cover travel costs and accommodations and per diems to ensure that team members are able to travel safely around the country. Examples of projects. So a number of things, and I encourage you to review the JD, which goes into some detail, but there are a number of projects that the Chief of Staff will support on. These include the development of the next stage of the organizational strategy, supporting with projects such as identifying revenue generation models, how we can integrate our partnerships and programs team, deep data analysis questions to better understand the cost effectiveness of our work, supporting me on various fundraising efforts, including the preparation of materials, undertaking due diligence, and potentially, if the Chief of Staff is able to get to this level, represent Fortify Health to external stakeholders at conferences, to funders, and other external stakeholders in my stead. The third question was around growth opportunities. There are two levels of growth opportunity that I see with the Chief of Staff role. The first is the Chief of Staff role would set someone up very well to lead a nonprofit in the future. The Chief of Staff will get a unique insight into the roles and responsibilities of a Chief Executive Officer or a senior leader in an organization that is growing rapidly. And so that type of learning is easily translatable into someone who may wish to start their own nonprofit in the future or be a senior leader in a nonprofit organization in the future. In terms of growth opportunities within Fortify Health, there is an opportunity in the future to shift into a strategic role. We have a strategic initiatives team at Fortify Health, and so there's a natural career progression into that strategic initiatives team for a Chief of Staff individual. I should note that while the JD notes that the contract is for 1 year, that there's a written expectation of being in the role for 2 years. So really the expectation is that the Chief of Staff will commit to 2 years. The reason for that is that this is a role that takes quite some time to onboard. it would take between 3 and 6 months to truly onboard onto this role because of the amount of unique knowledge and information that this person will need to learn. And so our expectation is that the individual would stay for 2 years in order to fully maximize the value of the role and the investment of time from both myself and the organization in that onboarding. And the final question was around the reopening of the role. This is true. This role was reopened. We have reopened the role with a new set of roles and responsibilities. And you will also note that the remuneration for the role has increased quite significantly. So what we have done is we've identified that we actually require a more senior individual for this role. If you did apply for the past role, you are more than welcome to apply again for this role. However, I do want to highlight that this role is at a higher level of responsibility and skill. And so if you were not successful in the past, I do want to set expectations that it is unlikely that you would then be successful at a more senior role. But of course, we review every application on its own merits. So you are more than welcome to apply once more. And yes, you are more than welcome to apply for any number of roles at Fortify Health. I encourage you to review the job descriptions clearly. We try to make them as clear as possible. And hopefully this is also an opportunity for you to understand the roles better. While you are more than welcome to apply for many roles, it does, of course, take time, and I encourage you to invest the time in your applications because we review each application closely before proceeding with applicants into the next stages of the hiring process. So I hope I answered all the questions. Ashwin, did I miss any questions there?
No. I think you covered all the questions. Perfect. So I can just answer questions. There have been some questions on partnerships manager role as well. So I can just have a consolidated response for all the questions. One of the questions is on the skills and experiences required for candidates that apply for partnerships manager. Now, if you see the JD, there is no specific number of years, but what we would like as a skill or an experience for you is to have at least had client-facing roles before. A client-facing role involves communication, verbal communication, and negotiation, persuasion being some of the skills that we look for. Also, since you'd be a manager, you're expected to have a team which you would be delegating tasks to, but also mentoring. So some experience working with direct reports would be one of the key skills that we are looking for in a partnerships manager. Above and beyond that, ability to manage projects, multiple projects, and people management. These are skills that we would require at a partnerships role. There are no specific background that we're looking at. Need not be from a public health background. So graduation doesn't matter in wherever you studied or what you studied. What does matter is experience and these skill sets. The last question is on which departments of government, state governments, and which areas Fortify Health support the state governments in addition to advocacy. So I can break it down into two parts. First is that the departments itself, we primarily focus on three safety net programs, which is the PDS, Public Distribution System, the ICDS program, which comes under WCD, and the MDM, which is also called the PM Poshan, which is the midday meal scheme. So we primarily focus on these safety net programs and their associated departments. But we also then work with other departments like the tribal department, wherever there is an opportunity to support the government in providing fortified wheat flour. Now, the support is advocating and persuading them to implement wheat flour fortification. That is one part of the role. But once the government agrees and starts implementing, we then provide technical support. So then the manager would be then expected to have a team who have technical background to manage the project, help the department to implement the program to ensure that high quality Fortify data is being provided to the beneficiaries of that program. So there's that two parts. One is the advocacy, and then there is technical support to the government and the safety net programs. Hope I've answered all the questions on the partnerships manager. Tony, there are some miscellaneous questions, so best for you to
Yeah, I
answer.
can respond to some of these.
Okay.
We will be launching an internship next week. If that is something of interest to you, please do subscribe to our newsletter and our social media. Our website has all open roles listed. If you've been asking about a role that is not listed, it means it is not opened. So please go to our website to see the roles that are available. And my colleague Arib just listed the website if you would like to go there as well. Nilav has asked, for senior roles like Chief of Staff and COO, does the 3-round interview include all technical, behavior, and leadership fitment checks? How different is the format expected to be from a mid-management role? Have a look at the job description. We assess the job description in the interviews. That's all I will say. Have a look at what the expectations of the role are, and that is what we will be assessing candidates on through both work tests and interviews. Vinod asks, what are some macro level KPIs for reporting to funder? I encourage you to actually look at the external dashboard on our website. Arib, if you may be able to share that. This is a live dashboard, which includes key performance metrics or key performance indicators that we make public for anyone to look at. They include metric tons of production, beneficiaries reached, number of mill partners, and geographies that we're operating in. And yes, you can see this dashboard. This is real up-to-date data, so you can get a sense of some of our key performance indicators. So I believe that largely answers the questions. If anyone else has any questions, we'll hold for about another 30 seconds. If we missed your question, please copy and paste it again so that we can see it at the bottom of the list. And if there are no other questions, then we may wrap up. So we'll just give you 30 more seconds. Please jot down any questions you may have. And in the meantime, if you don't have any questions, I encourage you to use the QR code to subscribe to our newsletter. We do post job postings through our newsletter and also our social media, especially our LinkedIn. We keep up to date. Kieran Mai asks, at a public health level, the implementation of long-term fortification programs failing there. I'm sorry, I don't understand the question there, Kieran Mai. So I'm going to skip over that. I'm not exactly clear. Ashwin, do you understand that question?
The question is that they have minimal risk of mass. I'm not sure what that.
I'm not sure what that means. So
Yeah.
I think we'll hold off responding to that. Not exactly sure. Wonderful. Well, thank you all for your time today. We very much appreciate you showing interest in the work that we're doing at Fortify Health. If you have any further questions, you are welcome to reach out at hello@fortifyhealth.global, which is our email address. And otherwise, we encourage you to apply for roles and hope to have you joining the team soon. With that, please stay healthy and speak to you soon. Bye-bye.
Bye, everyone. Thank you so much.